Hello everyone, I'm Leslie Cornwell, certified nurse midwife with Empowering Midwifery Education. This section has to do with setting up and cleaning tips for out-of-hospital birth. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local, unique situation. The course objectives, the students will be able to verbalize what's the role of the midwife, the birth assistant, the birtha team in preparing for delivery, whether it's at the home or the birth center, and from just getting there and setting up to the baby is closely coming. They'll be able to verbalize what to bring if they're a home birth midwife going out to a birth center, what supplies they'll set up. If it's a birth center, maybe talking to the clients about what to bring to the birth center, what supplies you have, what you need to set up at your birth center when a client shows up in labor. You'll be able to verbalize the setting up priorities depending on how quickly the birth is happening. If they're imminently going to deliver, what's the highest priority versus you've got time on your side, what are the typical routine steps. You'll be able to verbalize 10 key birth cleanup tips to focus on for training with new midwives and birth assistants after the baby comes. This topic is really important because you want to have consistent training, orientation, quality measures, and critical thinking skills when setting up supplies, resources, preparing for labor, because it can have a lot of safety implications if you're not gauging that she's close to delivering and you're casually setting up and talking about the weather with the client. You cannot have your resuscitation medications ready, your postpartum hemorrhage, check a set of vitals. If she wants the tub, you're quickly just closing the drain and opening the water up. Like there's things you're simultaneously doing quickly when it comes to birth, particularly the 10-15 minutes before the baby comes out and then that 10-15 minutes after the baby comes out. There are so many things happening in a short amount of time that a lot of people get overwhelmed and shut down and things happen and mistakes happen. And so having a consistent standard protocol of this is what we set up in how we take care of someone that's admitted into labor for the birth center. This is what we do when we go to someone's home and they asked us to come for labor and rule out labor or she's active labor, she's close to delivering, we got to rush and get there. Having a precipitate supply kit you can just grab and go wherever you need to will greatly decrease the risk of those emergency complications. You want your medications, you want your newborn care supplies easily accessible. So that's why bowls at home and the birth center to follow, and having a warm, firm surface with your resuscitation supplies that easily can transfer and move where the mother is going to are really important things to think about. So this is going to be talking about each person's role on the birth team and the assessments, the standard protocols, and the things you really just have to think about during labor, close to birth, and after the baby. So what exactly is the role of the midwife compared to the birth assistant in preparing for the labor process? When you're requested, when they're meeting you at the birth center, you want to really think about before they get there, the mom is really prepared. She's brought everything she needs to the birth center. She's got all the home birth supplies ready for when you come to her house with the birth team, towels, supplies that are just things you want her to have, and you're bringing the medical equipment. So the midwives will typically do a home visit around 36 weeks gestation if they're a home birthing mama. If they're doing the birth center, they'll give a good tour, they'll talk about things, they'll show the supplies, they'll talk about the birth, the resources available, the tub, the swings. I mean, so many things you can have available as resources, so they feel better prepared with the music and the aromatherapy and what they should bring and what you have on site. You have diapers, you have they got to bring their car seat, their clothes, depending on the weather. So you have to help so they can feel as prepared when the mom is coming to the birth center or you're going to their home. And the midwife wants to get a lay of the land. If GPS screws up and they've got a dog and it's 2 in the morning, and it's the middle of the day and parking is a challenge, like the midwives, when they're doing home births, they have to reduce that transportation risk and snow and backup plans for another midwife. And there's just things that have to be done to help reduce the risk of complications. So some midwives will have their birth assistants come to the home visit and come to a prenatal visit. Some of them have a pool of birth assistants and they just train them and they're part of the birth team when they arrive. So it's more your comfort and style with a birth assistant coming to a prenatal visit before the birth itself. But the entire purpose of the birth team is to make sure they can quickly assess whether they're triaging on the phone, they just arrived at the home, they just arrived at the birth center. They can quickly assess with their eyes, their ears, their knowledge, their skills, their questions, what stage of labor this mother is in and how quickly they need to prioritize things. Like, she's in super early labor. We're just going to let her do her thing. We're going to check her vitals. We're going to do a vaginal exam and recheck a vaginal exam in a couple hours. Or she's huffing and puffing and starting to bear down as soon as you get to the home, as soon as she gets to the birth center. You're quickly going to just set up the supplies to prepare for a birth happening. And then you slow down and breathe once you check she's 8 centimeters. But if they've had babies before and they're bearing down, we know as midwives they're going to have a baby pretty quickly. So we need to prioritize what we're focus on. So you want to ensure that the mom is as calm as possible, whether you're going to her or she's coming to you with the transportation. You want to go over their birth preferences and what they would like to, what their experience, their goals are. She really wants a water birth. She was traumatized last time. Her last baby was a really long labor and 10 pounds. She's had a C-section before. Like, you want to get to know and customize your labor support, your birth plan in a team approached model. It's her birth, it's her experience. And what's really important, she doesn't want you to say contraction. She wants you to say surge. She wants to have a lot of visualizations around. She wants this labor music played. She wants to have the baby immediately skin to skin and delayed cord clamping, some of these common things, but they just want to have a discussion with you about it. They want to be touched during labor and they want constant people around them, or they want to be private. They want us to be around for safety, but they want to be in the corner dark by themselves and we're there if we need them. So we have to really respect and customize our plans for when we take care of people, the initial assessment, the initial supplies, the initial priorities, and it's an art and it's a skill. And so one of the things we're going to talk about, I get asked a lot, is what do I bring to a birth? There's a lot of different variations of supplies. I think as new graduates, we tend to bring more, and then as we get more and more experience, we're like, okay, this has expired the last 5 years and I've never used it, so I'm not going to reorder it. I'm not going to take it. I've had multiple bags. I have my prenatal bag, I have my postpartum bag, I have my labor bag. I joke it's called Goliath because it's crazy heavy. I tell my families what I bring to your house for a home birth is similar to what they have in the drawers on those labor and delivery units. I have IV fluids, I have IV starts, I have tubing, I have medications, I have resuscitation, I have suturing supplies, I have lidocaine, I have spare gloves and labor support things and so many things in these bags because I'm coming to your house and I can't go down the hallway of my birth center and grab extras. I have extra pads, I have extra blankets, I have hats, I have all this stuff that I want to make sure I have extras of if I have to go multiple times in a row, depending on the volume of your practice. If you have a higher volume practice, you've got to have enough delivery instruments and suturing supplies and sterile things for 3-4 deliveries in a row, because you may not get another chance to go back to your office and restock before the next birth. So you have to think about, what do I need for safety for mom and baby and labor support? What am I going to set up? How am I going to set it up? So you want a Doppler, you want a fetoscope, you want a stethoscope, you want a blood pressure cuff to check vitals, you want things for labor support, you want to set up for the birth. So we would have a placenta bowl with a Chuck's pad in it, and we would put our Pitocin, Cytotec, extra gloves, sterile and regular. I'd have lubricant. I would have my delivery instruments so that I could just carry that around. We would do the newborn resuscitation supplies, a flat warm surface. We'd use a cookie cookie sheet, we'd put a couple towels, then we'd put a heating pad between the towels and the layer of the baby blankets. And most of the time that was just our warming pad to put nice warm blankets on the baby after the water birth, after delivery. But it was easy transportable if all of a sudden she moved and shifted throughout her house, and we want our placenta bowl and our newborn resuscitation things to be easily transferable, so that that flat warm surface, the cookie sheet, had the blankets, the towels, the heating pad, the intubation supplies, the ambu bag, the things I needed. The oxygen stayed close by to us. So those basic things, they were turned on, it was ready, we confirmed it was working, and then after the baby came, most of the time we'd put all that stuff away, and that's okay, that's awesome, that's great. But you want to have these things at your house just in case if you need them. You want extra gauze, you want extra towels, you want the suturing supplies, you don't want to run out of lidocaine. If you have to do that rare episiotomy, I mean, it's super, super rare, but sometimes you need to. You want extra delivery instruments, you want extra syringes and needles for administering the lidocaine and the Pitocin, and extra gloves if you have to give Cytotec rectally. Like, there's simple little things, and your birth assistant needs to be really, really trained well to anticipate your style, anticipate your specific needs. So setting up the birth space, depending if it's at home or the birth center, you're going to have a little more control and consistency. You're going to know what's in the drawers, the counter you're going to set things on, where you can wash your hands, where you can get restock of supplies, where light switches are, where extra towels and laundry, like, you know this space. But if it's a home birth, this is their space. You're going to have to ask a lot more questions. The partner, the team, I tend to have them take a tote and put everything I would need, so I try not to ask as many more questions that I have to during the labor process. But those are part of those things that we're in their space, and they set up their towels, they set up their music and their aromatherapy, and they want to deliver in their bed. They want to inflate a tub and do it in the living room. They want to do it in the basement. They want to do it, it ends up in their bathroom. Like, those are those adjustable things that you have to set up your birth space that it is mobile as much as possible to wherever the mother ends up. So you always want extra towels and sheets. You always never run out of having extra chucks and pads underneath. I learned this fast when I did labor and delivery for so long, and then I started doing community-based birth. You are housekeeping. If you get blood on something, you have to clean it up. You have to take care of it, versus we got spoiled in the hospital. The nurses would throw towels on the floor, use lots of extra things, and the housekeeping would clean up their mess after the mother was moved to postpartum. But in a home setting, in a birth center, you are housekeeping. You are all those layers of that team. And so you want to be conscientious of messes and spills and extra disposable things. A lot of our families for home births, I would say, hey, get towels, sheets, washcloths at garage sales, get them cheap, and then just have specific birth, labor, disposable things that you can just throw away afterwards. So you want to think about things to help with limiting the restriction of mobility. So intermittent monitoring, an open, wide space for them to walk in, to have a tub, to have a birth stool, to have a bed that has plastic and an extra layer that we can easily pull off after she has the baby. So there's just things you want to think about to set up and take care of the mother preparing for the birth. And then it comes to, these are some common tips we give new birth assistants, new midwives to the community center setting. What are some labor support tips, cleanup tips, things you can do that will really help improve that postpartum period? When they're at the home setting, you're there for about 2 hours. So there's a lot of things to do. Our intention and goal is to make it look like a birth had never happened there once we leave. So we'll start the laundry, we'll drain the tub if you had a water birth, we'll get all the trash taken out, we'll confirm if there's animals outside and where they would like the placenta. Do they want to keep it? Do they want it in the freezer? Do they want me to put it in the trash and we have to worry about some animals getting into it? We're going to drain the tub behind the back of the toilet, or we're going to drain it outside. I used to just do draining the tubs by gravity, but now I do it with a pump because I've gotten burned a couple times where she's in a basement and we can't take advantage of gravity, and now we're using buckets and it's taking forever. And a pump's a lot faster. Like, I just want to get that tub taken care of. A lot of times they would rent our tub, so I would just take it after the birth. We would have a liner. We would have peroxide and bleach and things to clean the tub and to clean the tubing that we would use to drain. So we had all these check and balances that the birth assistant was responsible for and the midwife was responsible for. With a birth center delivery, they stay for 4 to 6 hours, so you have more time on your side, and it's a lot easier for the cleanup. You just open up the drain of the birth tub in the birth center. You just clean up after they leave. You wash the floors, you take care of everything, you sterilize. You have a much more relaxed pace when they deliver at the birth center than when they deliver at home, because you just got less time and you want to get their space cleaned up before you leave. So definitely using shower linings, cloth drapes, tablecloths for barriers on the floor, for a barrier between the bed, whatever space they're going to deliver, particularly if there's carpets and cloths and sheets, you want to be conscientious of really using extra barriers. I mean, birth is not as messy as we think. In the hospital setting, they're laying with their legs up in stirrups and things go flying, versus in a home birth, in a birth center, they're upright, they're in the water, they're on the birth stool. Everything gets contained in the bowl, and it's not nearly as messy as our society and the movies tend to make it. So you want to just really be cleaning up and being conscientious of what you're using. Cheap things, disposable things, plastic liners that you want to be careful it becomes slippery when it's wet. You want to make sure that you're just getting the right size. I've gotten too many times where they picked up a drape cloth for painting and it was too small. It didn't fit underneath the water birth tub. So having them practice and test out inflating things, setting up for the birth, making sure the tubing and the liner, the hose fits to the sink that they're going to drain from. So those are just little things that really make a big difference. I can't stress enough how much I love disposable Chucks pads. You can get the ones that are washable, but it's a lot of mess and headache. And does the mom do it or do you do it? And who pays for it? And we just did disposable, and I would have an extra 20, 30 always in my car in the back. I'd have extra spare clothes for myself in the car. You just don't know as you start doing births, like, oh, I wish I would have had this, I wish I would have had that. So think about what could happen. What if I go from a few births and now I have to do office all day and I'm not going to go home to take a shower. I want to have a shampoo-less hair cleaning product. I want to be able to freshen up. I want spare professional clothes. I want spare birth clothes. I want Chucks to have extras. If we run out, she has a lot of bleeding. The last thing you need to do is run out of disposable pads because she didn't buy enough. Those are cheap, simple things. I've never had a birth where I've ran out of pads because I've always had so many extras in my car and with me in my bags, because that's the last thing. You're going to have far more work and headache. She can buy some for the next few postpartum days, but immediately after the birth, you don't want to deal with drips and spots and messes because you didn't have enough pads. Hydrogen peroxide is an awesome thing to have part of the delivery list at the birth center. You immediately put it on a blood spot in cold water. The sooner you do it, the faster it'll come out. The longer it sits, you're more likely to stain things, and especially with the birth center and your space, you don't want to be buying linens all the time because you let things sit. And so we were pretty quick that as soon as the baby came out, we started cleaning up. She would snuggle in the bed. They're nursing. They're doing good. We would start sterilizing our instruments, and we would get the blood spots out of sheets, and we would start washing things right away because we didn't want to have our beautiful sheets stained for the next mom to use. You want to make sure if you have a birth center that you're cleaning it well, you're doing this proper standard protocols. A lot of times we would use bleach after the mother would leave because it's really strong, but we would rinse it pretty quickly. I've gotten burned where we didn't rinse the tub and things dried as a film, and then you're scrubbing, versus we do a really good rinse. As soon as we drain it and the mom is comfortable in the bed, we're rinsing with hot water and washing with a washcloth the edge of the tub, so we don't have to worry about scrubbing because things had dried on there. So those are just those little things. If you're doing a birth pool at home, you want to make sure you have a liner in it. If it's her own and it's her personal and she's not using it for everything else, she can do what she wants. But if it's a rental, there's multiple uses. You definitely want to have the tub liner. You want to have trash bags close to you, close to the birth, one for linen, one for trash. It's just easy. You don't want to just put things to the side. I mean, if you're using a fishnet to get out some of the stool during the birth process, you want to be able to easily just put it and hide it and get the smell and get it taken care of. So these are just little etiquette things to always have. I would use my birth stool, my Dubai birth stool, and that would be my trash can holder until she wanted to use it. After the getting out of the water from the birth, I would put her on the birth stool, and that would be an excellent place to deliver the placenta. If she didn't want to deliver it in the water, everybody is different. But there's just little tools you can have around you that will really make things streamlined and a really cool process. So you want to have extra liners, you want to have stuff for hand sanitizer, cleaning up, preparing the bed very careful, multiple layers, make sure the plastic doesn't slide. It's really sad. I mean, my second kiddo, I had a stain on my bed for many, many years. It didn't come out from the birth. So, I mean, you just have to think about the labor and trying to protect their stuff at home as best you can possible. And at the birth center, the last thing you want to do is replacing a bunch of linens and mattresses and sheets and towels and things because you weren't cleaning, and being conscientious of where the blood is going. Cool thing is water bursts make things really, really easy. Most of the mess stays contained, and you just put it down the drain. It's a really awesome process. The messiest part usually comes after the placenta. You can deliver the placenta in the water. You can deliver the placenta on the birth stool and on the toilet. You can deliver in the bed. There's just a lot of different ways. So having a bowl and having a few chucks pads, you can put a few layers underneath of her. Put 3, 4, 5 layers that you can just peel off the top layer, versus you have to have her sit and lift up her butt every time you want to replace a pad. So I would have lots and lots of layers, and I just peel off the top. It'd be super easy, low key. So you want to just, these little things make a big difference being a midwife, and personalize, and not as, we're still doing things, but we're doing them in much more gentle ways. So those are just little things to think about. Draining, cleaning up the pool, depending on if it's at her home and it's an inflatable tub versus the birth center, and it's something that you have installed into the corner and part of the room. You want a checklist. You want to check for leaks. You want to make sure it's filled to the right height, the temperature is correct. As soon as she delivers, you're draining it, you're taking care of it. It takes a little time for at home and the pump to empty it and drain it, and so you want to get going on that right away. You want to, if there's any stool, to make sure that doesn't clog up drains. You want to take care of floating debris. I know there could be little remnants left from the birth process, and just the fishnets are awesome to have for home and birth center. So you just want to be conscientious of a drain and the home versus the birth center, and even plumbing at the birth center, putting in a large drain where it drains quickly, because if you have an emergency and then all of a sudden there's a shoulder dystocia or the baby comes out with a short cord, you want to think of safety. As soon as you hit that drain, it's going to drain quickly for you. So there's multiple purposes to think about when you're implementing a tub. You don't want any placenta remnants or any gross things draining it. I joked, but I didn't joke with the plumbers. I was like, you want to make sure you put in a really good drain, because if it gets clogged, I'm calling you, and you don't want to take care of the stuff that's in here. So we really have to be conscientious. We have to clean with the national standards for infection between use. We want to immediately clean the tub because it's going to be used by other people. You don't want risk of infection. You want to discuss the process after the baby comes, whether it's home, birth center. What are we going to do for you? What's going to be done before we leave your house? What's going to be done before you leave the birth center? The dad doesn't have to worry about the tub. We've got the tub. You focus on the baby, and we'll take care of the trash. We'll start the laundry. We'll get you guys some snacks that you have set out. Our goal is to make this as smooth of a recovery process for you and baby as possible. And then the birth center, we've got all our stuff in flow, and we'll cater to you. And then you just want to make sure you are taking care of, as the birth team, the cleaning up. It's not the role and responsibility of the mom and the family. So just thinking about, midwives are amazing, especially community-based midwives, our birth teams. Like, we wear so many hats and roles. We do labor support, we catch the babies, we advocate, we give a great birth space, we become laundry, housekeeping, cleaning service. We do all these things, part of our role, and that's what makes our jobs and our responsibility so amazing. You're not just catching the baby like in a hospital setting. You're going to want key supplies and consistent protocols and check and balance systems. After the babies would come out, we had great charting systems that we had to complete everything on our checklist before we left the home, before the mom left the birth center, so nothing got missed. We had a consistent flow. We knew the role of the birth assistant. We knew the role of the midwife. The midwife typically would chart after the baby and do high level assessments. The birth assistant would help the mom to the bathroom while the baby was getting the newborn assessment done by the midwife. You just get this team bonding flow of labor and quickly assessing people and determining priorities. And then after baby comes and everything's good, you've got your check and balance system that you're getting things done, so you're not there for 3-4 hours at a time because you're not organized and in a good flow. So it's really important for us as the birth team to not just think about the care, but to think about the standards and quality of setup before the birth, labor support. How do we handle the supplies and the setup for the birth itself? And then after the baby comes out, that recovery process, how is the standards? What's disposable? What do we wash afterwards? What is the highest priority? It's always safety. If we're having bleeding issues and newborn transition issues, that always trumps all the equipment cleaning and supplies and drains and everything. But you've got to pivot. We have a lot of multiple responsibilities as midwives and birth assistants for that first hour after the baby comes out and right before delivery. So we have to wear multiple hats at all times.